Learn efficient pharmacology, Pharmacokinetics Part 4, Distribution. We have seen that in absorption, the drug moves into systemic circulation. In distribution, it moves into tissues. Now, the question is, how does a drug in the blood vessel enter the tissue? For this, first the drug has to cross the vessel wall to enter the interstitial space and then cross the cell membrane to enter the intracellular space. Let's start with the vessel wall. We know from our physiology lessons that in the vasculature, the exchange of the solutes takes place primarily at the level of the capillaries. But as we saw earlier, the body considers a drug as a xenobiotic or foreign molecule likely to cause harm. So logically, the body would try to restrict drug entry to certain critical areas like the brain and promote its entry into tissues like the liver so that it can be metabolized. Now, among the capillaries in the body, two types are shown here. Pause the video and guess which of these would be most suited for the brain. Remember, the body tries to restrict xenobiotic entry into brain. This one. Here, the endothelial cells have no pores or fenestrations, and they are also connected by tight junctions. This leaves no opening for the xenobiotic molecule to pass through. Such capillaries form the blood-brain barrier. Let's compare it with this one. Here, the fenestrations in the endothelial cells are large and the gaps between them are wider. It should be easy to guess why this type of capillary is suited for the liver. Because in the liver, the xenobiotic needs to cross the vessel wall easily so that it can be metabolized. These examples represent two extremes. One that tries to severely restrict passage and another that allows unrestricted movement. For further discussion, let's choose a type of capillary that falls in between these extremes. Be it a fenestration or an intercellular space, a drug molecule must be small enough to pass through. This is where things get a bit interesting. Once a drug enters the blood vessels, some molecules may bind to the plasma proteins like albumin or globulins. This results in two fractions of the drug, protein bound and free. The drug molecule on its own may be small enough to pass through the fenestrations or intercellular spaces. But when it binds to the big protein molecule, the resulting drug protein complex is much larger and it can no longer pass through the fenestrations or intercellular spaces. So, only the free drug is available for distribution into tissues. Now, if the endothelium is non-fenestrated with tight junctions or the drug molecule is too big, does it mean that a drug can never cross the endothelium? Of course not. It could still move across through the endothelial cell membranes. We have seen the factors affecting this movement in the series of videos on the passage of drugs across a plasma membrane. Check out these videos by clicking this link. Now, the drug is in the interstitial space. To enter the cell, it has to cross the cell membrane. And here too, the principles of membrane transport from the earlier video series are applicable. Can factors within the cell affect distribution? Consider a tissue with high lipid content like adipose tissue or brain. A highly lipid-soluble drug will dissolve in the lipid and is likely to distribute more into these tissues. Similarly, a drug that binds to melanin may accumulate in melanin-containing tissues like retina. Or a drug that binds to muscle proteins may accumulate in the skeletal or cardiac muscle. Thus, a drug may accumulate more in one tissue than in other tissues. So the obvious question is, how much does a drug accumulate in a particular tissue? Or in other words, partition into a particular tissue from plasma. This is represented by the tissue plasma partition coefficient, or Kp. But for any of this to happen, the drug must first be delivered to the capillaries. This depends on the blood flow to the region. Logically, the drug will be distributed faster to highly perfused organs like liver, kidney, brain, and slower to less perfused tissues like fat. Now we can summarize the major factors that affect drug distribution: capillary permeability through endothelial fenestrations and intercellular spaces, molecular size of the drug, plasma protein binding, factors that affect the movement of a drug across the membrane like ionization, pH of the medium, lipid solubility, membrane transporters, lipid content of tissue, tissue binding, regional blood flow. Here are some good to know facts. In the next video, we will see how real life conditions affect these factors to alter drug distribution.